beginning of reopening. And so this is just a wonderful time and a wonderful day for all of us. And I just wanted to start by recognizing all of you, our media partners, for just the incredible amount of work that you have put in and all the efforts that you have given to us to be our partners in championing messages. We know it's been difficult for us. We've been difficult for our communities, and certainly you've been with us every step of the way. So I wanted to just, again, as I do every week, start off by saying thank you to all of you. It is so exciting to have reopening today. You know, we know that it's been over 15 months of various activities in fighting this pandemic. We know stay home, stay healthy orders that were issued back in March of 2020. There were a lot of different milestones that we have approached and passed to get to where we are today. I wanted to take a moment to certainly talk about some of those milestones, but I also wanted to, as we are commemorating today, and we know that there is incredibly great news as we are seeing our state reopen, we also want to make sure that people recognize that this pandemic is not over. It's far from over, and we certainly want to do everything we can to get people vaccinated, and that work continues. That work does not stop. That work is going to remain key to the work, to all of our work moving forward. As you all know, and Julie, if we could go ahead and show the slides here, we have really, from the beginning of this process of seeing COVID play out in our state, this is back to the first case that was announced in January of 2020. As you all know, we had that first case in Snohomish County, just north of Seattle, and certainly then the first outbreak and deaths that occurred in February 2020 really just highlighted all the different activities that the state of Washington and our partners across the system were engaged in. And while we were engaged in those activities, the rest of the country was watching. Since that time, we've had over 450,000 cases of COVID-19, and unfortunately, just shy of 6,000 deaths, 5,900 deaths since that beginning of January of last year. We remain one of the states with the fifth, with milestones of effectiveness in our response, fifth lowest in terms of cases, seventh lowest in terms of deaths per 100,000. We're the ninth highest percent population fully vaccinated. And we know that while the pandemic continues, we want to thank our partners in public health, healthcare, government, business, and certainly our community members across the state. We're grateful for everyone who stayed home, kept their distance, wore masks, got vaccinated, and we know that hard work and that sacrifice saved lives and paved the way to reopening. So as you look at this timeline that Julie just put up, and I know I went off script, so she had already pulled it down. As you can see, in March of 2020, we began our partnership with 211 for state hotline. Since that time, we've had almost 345,000, close to 350,000 calls, plus more than 32,000 vaccine appointments that have gone through that hotline. June of 2020, Care Connect Washington started in Yakima statewide by January of 2021. As you know, that was both food kits and isolation quarantine support for over 32,000 people, representing 8,700 households. November of 2020, we launched WA Notify, and as you know, that was recognized across the country with over 2 million users, and we have estimates of saving anywhere between dozens and 120 lives that were prevented, and 6,200 cases prevented in the first 4 months. In January of 2021, we created the VACCS Center. As you know, Dan Laster on this press briefing is going to be talking about that. And we've worked with over 50 partners on projects, including Vaccine Locator. In January of 2021, our state mass vaccination sites opened as well. Together with the Yakima Federal site, we vaccinated more than 380,000. We administered more than 380,000 doses at those mass vaccination sites. And then in February of 2021, we had our first collaborative meeting with our equity-based groups with 120 plus community-rooted organizations and and partners that came together. The bottom line is that as we look at what has occurred over this last year and now moving to June 30th of 2021, we can look back and say that we in Washington have been successful. We have had a strong response, a robust response, and I was with the governor today. I cannot give enough credit to the governor and his team for just the steady hand that they have provided to the state in leading us through this horrific pandemic. But moving forward, we want to continue to emphasize to people vaccinations. As you can see on the graphic here, we've had almost just shy of 8 million doses of vaccine that have been given to more than 4 million people in the state of Washington. And as you see on this slide, more than 3.8 million people are fully vaccinated, which represents, as you can see, half of our total state population as of today. 69% of our population 16 years of age and above has received at least one dose of vaccine. And that includes obviously our numbers related to the Department of Veterans Affairs, as well as our partners at DoD. But 69% of the population with 16 years and above with at least one dose of vaccine, which is just an amazing number of percentage of people that have been vaccinated as well and thereby protected. But as I show almost every week, it is a tale of two societies, and we want to do everything we can to recognize that those who are unvaccinated remain unprotected, and those who are 45 to 64 are 16 times higher likelihood for being hospitalized if they are unvaccinated. And if they're 65 years of age and above, they are 12 times higher risk for being hospitalized by COVID-19 or from COVID-19. And that's such an important fact for all of us, that while we have made a tremendous amount of achievements, while we have had a tremendous amount of success, we absolutely have. We are one of the leading states in the country. What we want to emphasize is that we are still seeing counties and communities and people in those counties and communities that are not still vaccinated, and thereby they are unprotected. And unfortunately, if they continue to partake in certain behaviors, they are going to be at risk for hospitalizations. And we want to continue to emphasize the importance of vaccinations. I'm going to have Lacy talk about reopening and some of the specific guidance related to the mask guidance order that I issued yesterday, and certainly other protective measures that are in place. But we want to make sure that everybody knows that reopening means that most businesses can operate just like they were prior to the pandemic. However, that doesn't mean the pandemic is over. Counties and establishments may still have continued restrictions, and we want to make sure that you respect the rules of the room, and you know that you want to check in with what's happening in that community, that establishment. Certainly, if you make travel plans to go out of state or out of the country, you want to make sure people are taking the appropriate precautions and aware of what's happening in those communities or those locations where they're going. The Secretary's mask order, as I mentioned, was updated yesterday. But it is still in place. And I want to make sure that people recognize that if they are unvaccinated, the precautions such as masking remain. And we want to make sure that people do recognize the importance of that, except for obviously outdoors where all of us do not have to wear our masks, unless the recommendation that we have is if you're in a crowded situation outdoors. It is really important that people, if they've only gotten one of their doses of the 2-dose Moderna or Pfizer vaccine, they make it a priority to get their second dose. We've been seeing some people not getting the second dose, and certainly we want to make sure the J&J vaccine, if obviously they get the first dose, that is the only dose required, and then they are vaccinated fully. If you're fully vaccinated, please talk to friends, family, neighbors, anybody you can talk to about the importance of vaccinations. Talk to them about their concerns. In Tacoma, I was able to talk to a couple of community members. A couple of them were on the fence, to be honest, about getting vaccines, and we were able to talk to them about the importance of vaccinations, and they got their vaccine as we were there. And I just really want to recognize the incredible work that our caravan teams, as well as our outreach teams, and all of our Department of Health teams have put in alongside our partners at the local level for just assuring that we are getting vaccine accessibility into communities across the state of Washington. And that is absolutely critical. But the other thing that is really critical is that we do get people vaccinated because we still recognize with these variants that Dr. Lindquist is going to speak of, we want to make sure that people are protecting themselves from those variants. And as we talked about today, when the governor was asked this question by the media, one of the most important things that people can do when we are concerned and people are rightfully concerned about the variants is to get vaccinated. That is absolutely critical. Get vaccinated. And certainly if they're not vaccinated yet, we want to make sure that people recognize that they still have to wear masks in settings, especially indoors. July 4th is coming up fast. We want to make sure people are taking it outside as best they can. And certainly if you're unvaccinated, again, I don't want to sound like a repetitive record here, but I want to make sure people get their vaccine, at least that first dose in as quickly as you can, especially because we want to get people protected, even if it's partially so before they, as much as we can before the 4th of July holidays that are coming up. We also want to make sure people are recognizing as they travel on the 4th of July that there is a lot that they need to be keeping in mind as they're going into other communities or other parts of the globe if they travel internationally, to see what's happening in those countries and to check what the status is of COVID-19 in those countries as well as elsewhere in the US before they make their travel plans. I would be remiss if I didn't acknowledge what happened over this last several days. I know all of you have been equally impacted by the heat wave, and certainly we are concerned about the safety and the well-being of our communities and community members alike. Of course, there's a wildfire risk, and we know that there have been many people that have unfortunately had to present to the hospital or healthcare system because of the heat wave and because of the temperatures rising, and that is something that we have been watching as well, and our team can certainly provide some additional details there. We do want to recognize that just as COVID-19 has been this ongoing threat that we have addressed, that the threat of climate change remains, and we want to make sure that we can do everything we can to have the health impacts of climate change minimized by doing everything we can to work towards solutions for climate-related events and their impacts on communities. So I've just said a lot of things, but let me close by saying the most important thing, which is we are reopened. It is Washington ready. This is a great day for all of us in Washington, and it is a great day for all Washingtonians. Our work is not done. For those who are vaccinated, thank you for everything you have done to champion vaccines for our communities. But for those who are not vaccinated, please do everything you can to get vaccinated. We do not want you to be unprotected and thereby get sick from COVID-19, because largely speaking, in time, COVID-19, any sickness, any illness, or any death from COVID-19 will become a preventable death. And we want to prevent as many of those as we can in our communities. So with that, I just want to thank our team, everybody who's just done an amazing job. I'm just so happy to and pleased to be a part of the incredible milestones of success that we've had, but we know we've got a lot of work ahead of us. So with that, Julie, I will turn it back to you. Thank you.
Thank you, Secretary Shah. Next, we will go to Lacy Fehrenbach. Go ahead, Lacy.
Good afternoon, everyone. Glad to be with you today. As you heard, we are Washington ready, and most businesses can operate like they did back in January 2020, before the pandemic, with some labor and industry safety requirements in place. One exception to this is that large indoor events, events with 10,000 or more people, do have reduced capacity unless they do vaccine verification. And this exception will be reevaluated at the end of July. While many businesses, the arts and recreation sectors, are back to normal starting today, and life feels a little more normal, especially for those who are vaccinated, as Dr. Shah mentioned, the Secretary's mask order remains in place. And this is because the pandemic is not over. We have more people to vaccinate in order to continue winning our race against the variants and protecting our communities. The order has been amended, as you heard, and just a reminder now of where and when people need to wear masks. It's always a good idea, even if you're fully vaccinated, to have one with you in your pocket, in your car, in your handbag or backpack, just in case. So public indoor settings, only those who are unvaccinated must wear masks. If you're outdoors, no one is required to wear masks. However, we do recommend that those who are unvaccinated wear a mask if they're at a crowded event like a sports event, a concert, fairs, parades, things like that. Outdoor sports, swimming or water recreation, no mask needed. Indoor sports, only unvaccinated people are required to wear masks. There are some specific sports with exceptions, and those are outlined on the Department of Health's website. In settings like schools and childcare, where a lot of people can't be vaccinated, or in congregate settings like healthcare, correctional facilities, homeless shelters, and public transportation, everyone is required to wear a mask, whether you're vaccinated or not. And we always want to remind people to respect the rules of the room you're in. Local jurisdictions and businesses may have stricter requirements than we do. That also includes your own employer, who must follow labor and industry worksite requirements. We also encourage you to support those who wear masks. Many vaccinated people may still choose to wear them because they have kids for whom they're modeling, or they have other health concerns. I want to wrap up with gratitude. These 18 months have tested all of us in so many ways, and they have caused devastating loss. However, in addition to honoring all that we've lost and suffered through, we have to celebrate the heroic efforts of millions that helped get us to this point. From treating the severely ill, starting with the nation's very first patient 18 months ago, to responding to outbreaks, to vaccinating more than 7.7 million people, we owe a huge gratitude to our public health workers at the tribal, local, state, and federal levels, healthcare workers in hospitals, FQHCs, community clinics, and pharmacies across the state, our first responders and National Guard, and countless volunteers. We also want to give a shout out to our essential workers, including those in food and factories, and food and factory environments, grocery stores, and our childcare and early learning providers, to name a few. These folks kept society going and provided critical infrastructure to our state throughout the COVID-19 response. Our partners in higher ed and K-12, who had to innovate time and again to provide education to the next generation of Washingtonians and leaders in our state, and had to support them emotionally through the pandemic. Our private sector partners, who were leaders in allowing remote work, changed their business models to fit health and safety guidance that was rapidly changing with the science, and those who stepped forward to provide various supports to our response, from procuring PPE to the delivery of vaccines. Finally, faith-based communities, sports leagues, the arts, and community groups who found ways to help people heal, be comforted, and even find joy in this really difficult and very remote and isolated environment. We'd also like to thank our media partners and local governments and those who helped get the word out to Washingtonians about how they can protect themselves, their families, and communities, and most importantly, all Washingtonians, for staying home, wearing your masks, watching your distance, keeping your social circles small, using WA Notified, and getting vaccinated. These collective actions brought us to this day. We are Washington ready because of each and every one of you, and we're here because we did it together. Let's go forward together into recovery to build back more resilient and healthy communities going forward. Back to you.
Thank you, Lacy. Next, we will go to Michele Roberts. Michele?
Good afternoon, everybody. Once again, I'm Michele Roberts, and I'm the Acting Assistant Secretary for our Prevention and Community Health Division, and I lead the COVID vaccine team here at the department. Washington is back open, and we are all excited and proud about the work that has happened to get us to this point. As Lacy just said, this group of us really represents the work of probably tens of thousands or more of people across the state in public health, tribal nations, healthcare, community-based organizations, our private sector partners, and many, many others who've worked to ensure equitable access to COVID vaccines for all Washingtonians. Vaccines are definitely the key to our health and safety and this economic reopening that we're celebrating today. As much as there is to celebrate, as Dr. Shah said, the work is not done. About half of the state's population is fully vaccinated. And if you haven't been vaccinated now is your time. We are asking everyone to go ahead and get vaccinated. If you have questions and concerns, talk to a trusted healthcare provider or get a trusted resource to get those questions answered. We've worked hard to ensure vaccines are available where it's convenient for everyone. And getting vaccinated will protect you, your family, and your community. And you'll be able to return to your regular life for the most part. Another area I want to highlight is the importance of childhood vaccinations. Currently, everyone 12 and older is eligible for the Pfizer COVID-19 vaccine, which can be given at the same time as other vaccines. Immunizing children on time is the best way to protect your family from many diseases. During the pandemic, childhood immunization numbers dropped as people skipped seeking some routine medical care. This is very concerning and puts kids and communities at risk, but it's not too late to catch up. This week, families with children aged 4 to 6 will receive a letter from DOH with information about which vaccines their children may be missing, as well as required immunizations for the upcoming school year. All students, including those learning remotely, need to follow the immunization requirements when school starts in the fall. If you have questions about the COVID-19 vaccine or any other vaccine, please visit DOH's website or talk to your healthcare provider. To make a vaccine appointment today, visit our vaccine locator website or text your zip code to Get VACCS, and you'll receive addresses of nearby vaccine sites. Or you could also call our COVID-19 vaccine number, 833-VACCS-HELP. Thank you.
Thank you, Michele. Next, we will go to Dr. Lindquist. Go ahead.
Okay, thank you. So with the variants, the best analogy are the books on the shelf behind me here. When we first started this pandemic, we had variants as varied as the books on the back of the shelf. We are now down to really just 3 books that are predominating this library. And unfortunately, it's one of these 3 books that you're going to be exposed to if you're unvaccinated and you come in a room like this. So that's the biggest problem. Those 3 main books we are seeing right now in Washington State are the Alpha variant, which is the B117, or what was previously called the UK variant. And that has really been outcompeted over the last couple time periods we've looked at these, and we're now down to about 46% of our isolates are the B117. So what is out competing the B117 is the P1 variant or the Gamma variant. And that, though, has decreased this week because it's being outcompeted by the Delta variant. And the Delta variant is getting a lot of attention worldwide and US wide. The Delta variant in Washington is about 17% of all variants, and the P1 is 16% of all variants. So those 2 variants are really competing against each other. What is still of concern is this Gamma variant, or the P1 variant, has essentially twice the hospitalization rate of the average and twice the death rate of the average. The Delta variant isn't quite as aggressive as the P1 is showing in Washington State. That is the big concern worldwide, is that they're having increase in cases in certain countries because of the appearance of the Delta variant. We are not seeing that in Washington. Our rates are going down, and our Delta variant is not as aggressive. It's not causing as many hospitalizations or deaths as would be predicted, but the P1 tends to be causing more hospitalizations and deaths. So at this point, I would say that this Delta variant is likely to be much more predominant over the next week or 2, and that we'll watch closely for how this is competing and what this means for increased incidence. Of course, the big question on everyone's mind is, will we do what other countries or states are doing to reinstitute masking guidance if the Delta variant becomes predominant and aggressive? And the answer to that is not at this time, because we are not seeing increases in cases and we are not seeing increases in severity at this point. So we are not currently considering a reinstitution of the mask mandate. You can imagine that's going to have a lot of implications, but we will be watching this very closely. We are just not there at this point. And I'd open this up. Dr. Shah, anything you want to add about that, about us watching these variants and what that means to reopening and possibly reinstituting masking?
Yeah, Scott, I don't know if you wanted just to cover the vaccine coverage related to variants. I think that's been an ongoing question that we've gotten a lot related to these 3 vaccines that we have currently and the coverage effectiveness for the variants, at least that we're watching currently.
Yeah, I mean, the main point that Dr. Shah's making here is that all the vaccines we have in Washington State still show effectiveness against these variants. There is some concern that one of the vaccines, the J&J vaccine, may not be as effective against Delta or even Gamma, but we are not seeing that yet. Again, we will watch that closely. So our current guidance is it's much more of a risk to be unvaccinated in this state right now than it is any concern for the vaccine not working against these variants.
Great. Thanks, Dr. Lindquist. That's, I think, absolutely the message. So spot on. And I think we can turn to Dan, and then I want to make sure if there are any questions for you or Dan. I know you have a hard stop at the top of the hour. We can certainly let those questions come to you right after.
Great. Can you hear me? Just want to make sure. Great.
Yes.
Well, good afternoon, everyone. And I just want to echo the remarks in terms of the gratitude that we are where we are and Washington is ready. And I do want to, as director of VACCS, just really give a special shout out to the over 50 partners and volunteer groups that all came to help the state and the local health jurisdictions to get to where we are. It's really extraordinary. And Washington truly has been a leader in this regard, and other states have really looked to see how we've done what we've done. I just want to just point out 2 things. One is our great transportation partnerships are still there. For those of you or anyone you know who has not yet gotten vaccinated, if transportation is one of the barriers, Sound Transit, Pierce Transit, Spokane, and Valley Transit in Walla Walla, there are free rides still available in all those places. In Spokane, that will end on July 5th. So I urge you to get on a bus as soon as you can and get vaccinated. And for those of you where mass transit is not the solution, we do have these extraordinary partnerships with Lyft and Uber, and we do have a substantial number of free ride shares that we really welcome Washingtonians to avail themselves of. If you could put up the number just so folks can just see it once again. Thanks. Call 833-VACCS-HELP, and if you need a ride share, you can get the code there. And we do have them available. Anyone who might work with CMAR or some of their sister organizations, they also have Uber codes. So again, to do it all in one, make your appointment, get a free ride. We just really want to encourage and hope that everyone, the barriers can be eliminated and you can get protected. The second thing I just want to flag is, as has been mentioned by others, I mean, it is extraordinary where we are, and I'm just so excited that the health of Washington is returning, and including our economy. But there are those that still are not yet vaccinated. Our caravan is really focusing on community-based organizations, and really excited as we're launching that work. And the other area that VACCS is trying to continue to help is in terms of employers. Some of the large employers have had phenomenal efforts to vaccinate their employees on site. Other employers have worked with providers, but there are some who have not yet had the opportunity to come up with a strategy for making it easy for their employees. And VACCS is trying to reach out to employers to help coordinate that role we play in coordinating and matchmaking. So I welcome hearing from any businesses that really still have employees that need to be vaccinated. We are working in the next 2 weeks with one fairly large employer of over 1,000 employees, where they actually have already vaccinated half the workplace, but they think that more might be amenable to getting vaccinated if it were easy. So we are going to be working with them to have on-site vaccination. So anything we can do to help get shots in everyone's arms, that's what we're here for. And on that note, I'll turn it back to you, Julie, and just again want to pause in gratitude to the entire state that we are where we are, and how fortunate we are when you look at other parts of the world. And so that's why I just hope those of you who haven't gotten vaccinated yet, take the chance to get vaccinated to protect yourselves and those in your world. Thanks.
Thank you, Dan. And Dan and Dr. Lindquist have hard outs at 3 o'clock. So if we are unable to address your specific question, we will follow up with you after the briefing. We begin our question and answer segment of today's briefing with a question from Rachel at the AP. Go ahead, Rachel.
Hi, good afternoon. A couple of questions. One, what is the vaccination threshold at which the remainder of the mask mandates would be removed? And then for Dr. Lindquist, I know you said the state hasn't yet seen data that creates any specific concern yet about efficacy between the 3 vaccines to the Delta variant here in Washington state. But are you all getting a sense that a booster for some groups may be needed based on some of the broader data and comments from scientists that's out there currently?
Yeah, let me let Dr. Lindquist answer that second question first, and then Lacy, if you want to maybe take on that the question about the masks.
Yeah, so I think what I'm looking for very closely right now is when we have these breakthrough cases. So these are people that have received 2 doses of vaccine, completely vaccinated. Are we seeing a predominance or disproportionate amount of either the Gamma or the Delta in those? And the answer is not of yet. Again, we've got about 2,200 breakthrough cases that we know of. That's not unexpected given the close to 7 million doses we've given. That's actually a very, very small percentage of those doses. So that is not unexpected, but we are not seeing a predominance of Delta in that group at this point. So I'm watching that every day. I look for it. And certainly every week we do a breakthrough report, and we also do a variance report. We also look at the hospitalization percentage of those by variants, and we also look at the death by those variants. And again, that's what I'm saying. We're not seeing big clues to any of these variants becoming predominant in severity. And then the other thing, of course, that other countries are seeing is they're seeing a massive rise in cases. And when they look at those individual cases, they're Delta variant. We are not seeing a rise in our number of cases. We are seeing an increase in the percentage of Delta. Now, that may be an early signal, so we are watching that super close. But again, I keep saying this every week, we're one of the top states for doing genotyping to keep on top of this data. So we're getting very much real-time feedback on what it looks like in our state. Yes, I am hearing of some discussion about will there be a need for a booster for these variants in particular. And there's clearly no set upon or agreed plan for that. But one thing, Michele, I'd ask her to weigh in on this. Of course, we're preparing for that in case that is the reality, but there is no clear guidance on this at this point.
Yeah, I'll just add, we are starting our planning to ensure we're ready if and when boosters may be required, and thinking about special populations or circumstances where they will be or possibly will be. But we're really looking to the federal government for their comprehensive scientific review of the data that's starting to come out. And that could happen both at the federal CDC Advisory Committee on Immunization Practices and potentially through the FDA with their emergency use authorization. So I think we'll learn a lot more about this over the coming weeks. And I do expect that by the fall, we'll hear more from our federal partners about what may be next.
Thanks for the question, Rachel. So I'll start by saying we've made incredible progress. We're very proud of the efforts and the willingness of Washingtonians to be vaccinated. We have 50% of our total population fully vaccinated. That means half of us are still susceptible. We also see a lot of variability across the state and equity gaps that we're still working to close, and a reminder to all of us that any Washingtonian under the age of 12 is not protected and can't be protected yet by a life-saving vaccine. So we're not yet in a place to pull back a mask mandate. We're also monitoring very closely the emergence of these variants and the situation in that regard and our disease levels. So, I don't know that this decision would be made solely on a vaccination rate. That will be a very, very, very important factor, but there will be multiple factors that we look at as we go forward.
Yeah, and if I could just add to what Lacy said, I think her last point is probably the most important, is that there are a variety of factors that we're going to continue to monitor and metrics. And as you heard with Dr. Lindquist, he's watching the genotyping reports every day. He's and the team are looking at breakthroughs. We're looking and watching, obviously, how effective vaccines are with the variants. We're obviously watching what our percentages are. We're looking at a number of factors, including cases, hospitalizations across different counties and communities across Washington. When you bring all that in, it's a complicated, complex mix of different factors that come into play. So I just want to appreciate that it's not just any one factor. And I also know that Dan Laster had to drop off, but I want to thank Dan for his continued support, leadership throughout this process as the director of the VACCS Center. So thanks, Dan. And Julie, we'll turn it back to you.
Thank you. Our next question comes from Ariel at the Spokesman Review. Go ahead.
Great, thank you. I have two quick questions. The first is to confirm that we did not hit that 70% threshold goal as of today for Washington residents over 16 vaccinated. And the second question is sort of just following up on what Dr. Lindquist was talking about, but sort of in light of what we're seeing with the Delta variant in Israel and breakthrough cases, should communities with lower vaccination rates be more wary in their approach to reopening and perhaps continue to wear masks? Thank you.
Let me let Dr. Lindquist answer that second question. Let me just say really quickly that we were, as we mentioned, we were at 69%. So we did not get to that 70% mark. I do want to make it very clear that's the 16 plus. We did hit the 70% mark for 18 plus, which, as you know, was what the president had put in place for states across the nation. We were, I believe, the 13th state to reach that milestone. So from the 18 plus standpoint, we did reach the 70% threshold, but from the 16 plus, which is the metrics that we were using, we obviously didn't quite make it as of today. But I have a feeling if we continue to march along and people remember that we are still in the pandemic and why vaccines are important, that very shortly, very soon, we should be able to hit the 70% mark as well. Scott?
Yeah, I think you said it very well. The bottom line is you really only got the predominance of 3 viruses in the state right now, and they are much more serious than the viruses we knew of before. So yes, in areas of the state where the vaccination rate is low, I can't say it any more plainly than you did. These are cases that are completely preventable. We can save a lot of pain and suffering and death. So if I make this plea out to anyone that isn't vaccinated now and we save one life, it's worth it. Because the choice of the variants, and you don't get a choice, you get what's in your community, is no choice. They're all 3 fairly significant players. And please, 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 for the love of yourself, of your family, of your friends, or people that you may pass this on to, please get vaccinated so we can shut down these variants in the state. And it's time to be done with it.
Thanks,
Thank you.
Scott.
Our next question comes from Nicole at Cairo Radio. Go ahead.
Good afternoon. I'm wondering, we've been hovering now between kind of 68, 69% for a couple of weeks, so it really seems like things have plateaued. Can we be confident that we're at herd immunity? And what does this mean in terms of these variants and in terms of kids who can't get vaccinated yet?
Yeah, Scott, I know you need to drop off, so did you want to say anything before you drop off on this question, or do you want us to handle it?
Yeah, so you guys can tell I'm wearing a stethoscope. It's not for ornamentation. I'm actually in clinic. No, I just stepped out to see where I'm at, and I've got some extra time here.
Okay, good.
A break and patience. Yeah, you know, it all is a race against those who are unvaccinated, getting them up to be vaccinated, versus getting infected with one of these 3 serious strains. And so, yeah, the best thing we can do is to get vaccinated. Don't lose sight of the fact that masks still work against these strains. That is still a very viable issue. But at the same time, we're trying to loosen mask restrictions. And it's a combination of all these things. It's a combination of appropriate use of the mask for those that are at risk. I think we say it best by saying respect the space that you are in. It's a race against time, getting a large percent of the population vaccinated. I know you're using the word herd immunity. I'm not a big fan of that because that assumes that there's universal across the state. If we say there's 70% vaccinated, that means universal across the state. And that is just not what we're seeing in Washington. We are seeing very large pockets of low immunization. And we have a whole very precious part of the community, which are our children that are unvaccinated. And the good news is we are not seeing these variants aggressively infect children. As a matter of fact, children are tending to have lower incidence rates, but it can happen. And so it's a race against time, balancing all these things: use of masks, getting vaccinated, and trying to end the competition of these really aggressive variants.
Yeah, the only thing I would add, and unless Michele or Lacy have something they want to add to this question as well, to this response as well, is that we have, I know I have, and it sounds like Dr. Lindquist as well, have been shying away from this word these words herd immunity, and really going more with vaccine coverage. And vaccine coverage is tricky, because you have vaccine coverage rates or percentages across the entirety of a state, which represents close to 8 million people. But then you also have vaccine coverage that's occurring in various specific communities. And even within a community, what's happening where people are potentially clustering. And that's the issue. When you have people who are clustering who are vaccinated, you're okay. When you have people who are unvaccinated and they're clustering and doing things together, again, just like we were in the middle of the pandemic last year, not wearing masks, not doing the things that they need to do to protect themselves or their loved ones, that's when you get into trouble. So it is rolling the dice to not get vaccinated. It is preventable. Is a preventable illness and even hospitalization, but you are rolling the dice at this point, because if these variants do tend to be more so in places where you have less vaccine penetration, now you are putting yourself at potential risk when you don't need to, and that is a real concern for all of us. So Lacy, Michele, I don't know if you guys had anything you wanted to add, or we're good. Okay, Julie, back to you.
Thank you. There are about 9 minutes left in the briefing and 2 reporters left in the queue. We are going now to Michael from King 5. Go ahead.
There we go. I'm unmuted. Thank you. Thanks for taking the time here with this. Dr. Shah, I guess with reopening today on in the discussion on variants and cases and what Scott was saying about not remasking yet, I guess I was wondering, with reopening and the variants out there and the majority of Washington counties that are still below that 70% vaccination threshold, what is your confidence level that we won't need to step backwards and reimpose restrictions in the coming months?
Yeah, thanks, Michael, for that. I never say never. In my 20 plus years in emergency response, I think if that's when you get the gotcha moment. Never, there's no way, absolutely. And the truth is, this is a super squirrely virus that has really broken every rule in the playbook, and we have done everything we can to follow and evolve as this pandemic and this virus has evolved. Variants are an evolution of a virus when you have a mutation and that virus has evolved. And so, we'll never say never because we just don't know what's ahead. But I will tell you that the more we get people vaccinated, the more we are protecting ourselves, not just protecting ourselves as in from a medical standpoint, but protecting ourselves from a shielding standpoint of our state not having to go backward. And so it really is hopeful for us that we continue to encourage and incentivize. And remember, we still have people that can win lottery. We still have the big lottery prize up ahead coming up in a couple of weeks. We still have Xboxes and all sorts of other things out there. We have people like today, as I mentioned, a few folks that I had talked to, and they were on the fence, and it was really just having a medical provider or a health provider or a nurse provider to give them the right information. So really, it's about one person at a time, which ultimately is what this is about, because those people make up a community, and a set of communities make up a state. And we're going to do everything we can to continue to encourage, incentivize, and make it easy for people to get vaccinated. But ultimately, people are going to have to roll up their sleeves and recognize why vaccines are important to their health, their safety, their well-being. And so I will never say never, but I would say that the more we increase numbers of people across the state who have been vaccinated, the likelihood is less so every single day that you have to go back to a previous phase in the pandemic. And let's hope we don't have to go back.
Thank you. Our final question comes from Joey at the Everett Herald. Go ahead.
Hi, thank you. As you're talking about getting ways for the remainder of folks to get vaccinated, is the state considering simply saying that, the mask mandate for unvaccinated folks, especially in a workplace setting, is just never going to go away, and that if you want to be able to go to work and not wear a mask, you have to get vaccinated, or perhaps, for the next 6 months at least. Is that something that's being considered, or is there a percentage that you might think, well, if we hit that, then, unvaccinated folks can go in without masks?
Well, Joey, thanks for that. I think one thing that should always be front of mind is that we do want to make sure that we are doing everything we can to encourage people to get vaccinated. And so if your employer requires you to wear a mask indoors because you're unvaccinated, well, guess what? Maybe over time you see all your coworkers and your buddies not wearing a mask at the cooler and the water cooler, and you're the only one that's required to. That might encourage or incentivize you to wear the mask. To get vaccinated, and hopefully then once you're fully vaccinated, be able to take that mask off. So I absolutely. I mean, there are so many things that we are considering behind the scenes to make sure that we are thinking of various contingencies. We're hoping that we don't have to execute on those. I will say the one thing that concerns all of us, and Scott, Lacy, Michele, feel free to chime in on this one, is we're really concerned about clusters and places in the larger state where those vaccine coverage numbers or rates are lower, and therefore you have people who are unprotected, still thinking that that they are fine and everything is back to normal, and getting in potential trouble because they're unprotected. That's probably the biggest concern that I have right now, is just encouraging people and trying to let people know, look, This is about your health, your well-being, and those around you. And if you can keep that in mind, that's ultimately how you're going to protect yourself.
I'll just add, I think one of the things that we've tried to do as public health and with our healthcare providers and others is share what prevention measures are available to people. And I think, we've all learned about the power of masking. And if we take what happened with flu season, where we really didn't have a flu season, and that's a disease that usually kills hundreds of people across this country. And this year we had in our state, no flu deaths, no long-term care outbreaks of flu. And that's the power of both social distancing and the power of masks. And so I think that will be something, hopefully all of us will think about what prevention measures do we have available to us in the future, and think about just risk of infectious diseases year round, especially during kind of the winter months of respiratory illness season. So just hopefully just some health behaviors we can all take forward in the future.
This concludes the question and answer segment of our briefing. We will now go to Secretary Shah for closing remarks.
Well, I just want to say it's June 30th, 2021. I think all of us were waiting for this day when we could say the state is reopened. It is. And I know that there were a lot of questions that were about what ifs and what could, and a lot of concerns that we equally have over time, that we're going to continue to monitor all the information out there. But today is a day to celebrate. It's a day to commemorate. It's a day to be excited about. It's a day for us to get back to some level of normalcy, especially those who are vaccinated. And so I just want to start by, again, thanking Scott, Lacy, Dan, and Michele, and Julie as well, and all the team that are behind the scenes that really allow us to have these weekly press briefings. We were not planning on doing one this week because we had an event for reopening that was planned that has been moved to tomorrow. And so you get a chance to see us again. The band gets back together tomorrow in some fashion in the morning. But what I did want to say is that ultimately we are very excited about the fact that Washingtonians can get back to seeing life as they had previously experienced it. And we all want that to be normal, and we all want that to be back to where we are. But we're not quite out of this pandemic. And so we want to make sure, especially those who are unvaccinated, please get vaccinated. That is the most important key message. Get vaccinated. Don't hesitate. Vaccinate. And finally, I just want to say, look, again, there's a long road ahead, and it's a super squirrely virus, broken every rule in the playbook. We're going to keep watching it. We're going to keep doing everything we can and must do day and night to try to follow this virus and follow this pandemic and do whatever we can from a public health standpoint. And we're so proud of our incredible partners on the ground who have just done that alongside with us at the Department of Health. So with that, I just want to say thank you again. Thank you to our media partners. And certainly we are Washington ready, June 30th, 2021. Don't hesitate, vaccinate. Julie, back to you.
I think you summed it up perfectly. Thank you, Dr. Shah. That concludes today's media availability. Thank you to all of our panelists and to TBW for hosting today's live stream and archives of past briefings. Thank you and have a great day.